Hello guys and assalamu alaikum. Welcome to Revised Pathology once again. So guys, in the previous video we have just seen the classification of leukemias, and afterwards I said we will proceed to the next to the next topic, that is AML. And I even said what AML, what is the meaning of AML, and do write it on the comments. And I got replies also, and among which one is Ash, I think so, if I'm not wrong in the pronunciation. And he said the right thing, that yes, AML matlab acute myeloid leukemia. So today we are going to discuss about acute myeloid leukemia. And another important thing that I would really like to say is that I am really glad to know that people are there who are watching my videos. They do even comment on my videos. I'm really thankful to all of you guys. Keep commenting like this, keep sharing, keep updating me. And there is even one comment that says, the man of the words, the name of the person. I don't know whether it's a male or a female, but he commented to update my the classifications. Maybe I'm using the old version of the book. I request him or her to please tell me what sort of classifications am I missing. Okay, is it you're talking about the fab classifications, that's FAB classifications, FAB classifications, or is this, or there is something else I'm missing? Please do update me with that also. I'm really, 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 very thankful to all the people, to all the viewers who are continuously watching me. And please subscribe to my YouTube channel, that is Revised Pathology. So let's proceed towards the topic, and that is acute myeloid leukemias. So, what is acute myeloid leukemia? First of all, it is definitely a blood cancer. As I said previously, that all the leukemias are cancerous, and then there are its different types. And if you see, based on the cell, in the previous video I even tell you the classifications of leukemias, and based on the cell, it is a myeloid cell leukemia, which is very important. And if you go according to WHO classification, it itself has a separate, it is itself separately classified into the same subheading, that is acute myeloid leukemias, in which it is being further subclassified into AML with differentiation, without differentiation, with maturation, myeloid sarcoma. Okay, and there is one or two more. I'm sorry, I don't remember it right now. Okay, so now we are today only going to say and discuss about AML, that is acute myeloid leukemia. Acute myeloid leukemia is basically blood cancer. Okay, and in short abbreviation we call it as AML, as I said it even previously. Now we cannot say, now for further more understanding, with all due respect, for further more understanding, we will know that what is it basically, what is acute myeloid leukemia basically. It's nothing but infiltration of malignant myeloid cells in tissue or tissues, blood, and bone marrow. So what is it? It is nothing but infiltration. Infiltration of malignant myeloid cells, matlab cancerous myeloid cells, into tissues, blood, and bone marrow. This is the thing you have to remember about AML. Now, this is an intro. Now, once we know, basically we get a basic idea that what is AML. So further we will go to its clinical features. You see, whenever there is any disease, it will always be presented in a person with some signs and symptoms. But being more specific, we will say clinical features. So, what are the clinical features, or what type of features will be there present in a patient or in a subject where we can say that the person has AML? that the person has AML. What are those? Now, if we come to the clinical features of AML, let me do it like this, okay? If we come on the clinical features of AML, oh my goodness. Sorry guys, sorry for the spelling. It is divided into two subheadings or two headings. I'm sorry, not subheadings, into two headings. First one comes bone marrow failure, and second one comes organ infiltration. Okay, so two subheadings occur. That means in this disease, two things happen. One thing, the first thing that happens is bone marrow failure, and then according to this, an organ infiltration also happens. Now, what happens once bone marrow failure occurs in AML? First thing that will occur is anemia. Second, bleeding tendencies. Third, infections. Fourth, fever. So, what will occur? Anemia will happen, bleeding tendencies will be there, infections will be there, and fever will be there. Alright, now let's come towards organ infiltration. What will happen in organ infiltrations once these malignant myeloid cells or malignant myeloid leukemic cells will infiltrate into an organ? What will happen? First thing that occurs is splenomegaly. Second, hepatomegaly. Third, gum hypertrophy. Next, infiltration, or it will be like this: leukemic infiltration of kidneys. Next, meningeal involvement. So these are the things that will happen. So once there is a bone marrow failure, what happens is anemia, bleeding tendencies, infection, and fever. Once there is an organ infiltration, what will happen? Splenomegaly, hepatomegaly, gum hypertrophy, leukemic infiltration of kidney, and meningeal involvement. Now, once it comes to meningeal involvement, what happens in meningeal involvement? Meningeal involvement means once the brain gets involved, okay, in these things. Once there is an, malignant myeloid cells will infiltrate into the brain. That is it. What will happen in meningeal involvement? So, so since meningeal involvement comes under organ infiltration, I will just write it under it only. Meningeal involvement. First of all, what will happen? Once there is a meningeal involvement, there will be raised intracranial pressure. Next, once there will be raised intracranial pressure, definitely what's going to happen? Headache. Next, blurring of vision. Next, you'll find nausea. Nausea. Okay. I think I'm missing a point. Please do correct me if I'm missing any point in the meningeal involvement. I think so. Deployed vision. No, I think so. I'm really sorry if I'm missing any point in the meningeal involvement, but please do write in the comments what am I missing. Okay, and that means there is a good interaction between me and between you guys, between my viewers, or what we are discussing here. So, guys, this is what we see once you will find clinical, or you will, these are, what I want to say is these are all the clinical features of AML, or you will find in a patient or a subject who is suffering from AML. Now, these are the features, but for a confirmative diagnosis, it is important that we go to have through some tests, and that is where we come to our next topic, or I mean to say to the next point, that is lab findings. What will you find? These are very important things we need to know. Lab findings. Lab findings. Without lab findings, we cannot know whether the person is suffering from AML or not. Clinical features are not always confirmatory things that the person is suffering from a particular disease. We need to go through a battery of tests to understand and to confirm that yes, this particular disease the person is suffering from, and so such and such is the treatment. Fine. So, lab findings. Obviously, how we will go through the lab findings? We need to take a blood sample of this particular person if we think that he is suffering from a blood disorder or he is suffering from leukemia or from blood cancer, as well as we need to take biopsy of the bone marrow. Okay, we call it as bone marrow examinations. That is further going to come. So, first of all, in the lab findings, we need to see what will come. So, we will say about the blood picture. Blood picture means whenever you take a sample of blood and you will keep it on a slide. So that time, whatever you see in the microscope, it's called the blood picture. Okay. Next, or else technical terms in pathology we call it as simple blood pic or blood picture. Fine. So the blood picture will show anemia, but the question is what sort of anemia. I will definitely come on the topics of anemia as well, but let's just complete with leukemias and other sort of blood cancers. Fine. It's a very vast topic. So blood picture will show severe and progressive normochronic anemia. This is number one. Next, what will happen to the counts of platelets, to the counts of WBCs, to the counts of of other elements that are present in the blood? So thrombocytopenia, that means decrease in platelets. That is why bleeding tendencies occur. Bleeding tendencies are more. Fine. A small cut and heavy bleeding. Okay. Next, leukocytosis. Leukocytosis means increase in WBCs. In case you see WBCs, they always play a very important role in fighting the infections, in combating the infections. If there's an abnormal count, whether up or low, it's very difficult to fight an infection. Fine. So leukocytosis and DIC. Now you will say, what is DIC? DIC means disseminated intravascular coagulation. You will learn it in the next topic. We will discuss about it in the next, after finishing all this chapter, all the this leukemic part, we will discuss about what is DIC. This is the blood pick of AML, which you guys need to understand that this is all what you will find there inside a blood picture of a person who is suffering from AML. Okay, as well as the most important thing is what I forgot is aurora rods will be present in them. Very important diagnostic feature. Aurora rods will be seen in them in AML. Okay, now let's go towards the bone marrow findings. Okay, B for blood, B for bone marrow. Let me to erase the rest. I hope so. You guys are understanding well what I'm saying. Okay, what I'm explaining. Bone marrow findings. First of all, if we see the bone marrow findings, what will be there? The bone marrow findings. First of all, we need to see the cellularity. It will be always hypocellular. Okay. Next point. You will see decrease in erythropoietic cells. That is the reason there will be less RBC. Less RBC produces anemia, and due to anemia, there will be TIC. Okay, so that is disseminated intravascular coagulation. So, decrease in erythropoietic cells. Next, tightly, I'm sorry, ow, tightly packed leukemic blastic cells. Okay, leukemic blastic cells will be tightly packed. Last, you will see decrease in megakaryocytes. That's why there will be decrease in platelets also. So these are the bone marrow findings that you will find in case of AML. Okay, guys, what is there? Cellularity will be hypercellular, decrease in erythropoietic cells, tightly packed leukemoblastic cells, and increase in megakaryocytes. I'm sorry, decrease in sorry guys, decrease in megakaryocytes. Now So, guys, as I have said, the cytochemistry, first of all, myeloperoxidase, it will be positive in immature myeloid cells. Pseudoin black, this dye also positive in immature cells. Periodic acid SNF or SHIF is positive, and non-specific esterase also comes positive. So that is it. Our AML is complete. And the next topic will be, inshallah, CML. What is CML? Write in the comments so that I can understand that you people are watching my videos and you people are understanding my videos and are interested in discussing topics with me. So kindly, please keep smiling and like my video, comment, share, and subscribe to my YouTube channel, Revise Pathology. Bye bye. Allah Hafiz. Assalamu alaikum.